Our next career opportunity is orthopedics and sports medicine. The team at HaysMed joins us with a look at these popular careers.
At HaysMed, healing means more than just treating injuries. It's about helping you move better, feel stronger, and get back to doing what you love. Our orthopedic and sports medicine teams deliver advanced surgical care, personalized rehabilitation, and performance support, all designed around you. Every success story starts with a team of experts. From your first consultation through surgery and recovery, our fellowship-trained and board-certified surgeons combine precision and compassion to treat joint replacements, sports injuries, and trauma care. These surgeries are designed to relieve pain, restore mobility, and improve quality of life. And as a Level 3 trauma center, we're ready 24/7 for urgent injuries like fractures and dislocations. When every second counts, our team is here for you. But surgery is just the beginning. That's where our sports medicine program comes in, helping athletes and active individuals heal, recover, and perform at their best. Whether you're a high school athlete, a weekend warrior, or part of the growing pickleball community, our specialists work with trainers, coaches, and rehab experts to create personalized plans for faster, stronger recovery. From advanced rehab techniques to collaborative care with local schools and athletic programs, we're here to keep you moving on the court, on the field, and in everyday life. At HaysMed, we don't just treat injuries, we restore lives. Expert orthopedic and sports medicine care right here where you need it.
I want to welcome our orthopedics and sports medicine panel to answer questions about the career pathways in this exciting field. Joining us today from HaysMed is Dr. Chima, specializing in orthopedics, and Dr. Wallstrom, specializing in sports medicine. Good morning.
Good morning.
Good morning.
Thank you guys for both being here. I want to ask each of you what drew you into the medical field, into being a physician, as well as this specialty specifically. So let's start with you, Dr. Chima.
Yeah, I was quite active in my school years in sports, and I grew up in Pakistan, so I did like a field hockey and cricket, and I played some basketball. So that just got me into the sports, and then that's how I chose my career as an orthopedic surgeon too.
What about you, Dr. Wallstrom?
Yeah, so similar with me as well. So I definitely was quite involved with athletics. I always know that I wanted to do something in the science field, and definitely the medical field. For the longest time, I thought I was going to be a physical therapist, and then this profession kind of found me. I tell all my patients that most people that end up in sports medicine are the ones that were injured a lot while they were playing sports, and that certainly was me growing up. Had a lot of injuries in high school and college as well, and this profession found me more than I guess I found it, but I love it, and it's been great. It was quite the road to get here.
That's a note to everybody watching. If you are injury prone, this might be the career for you.
True.
Well, I wanted to just talk to you a little bit about the kind of injuries you treat most. So let's start with orthopedics. What kinds of injuries do you treat most in orthopedics?
I think it's a good question. We treat quite a bit of sports injuries because one thing is we cover a huge area in Western Kansas. So we have a lot of sports injuries we have seen, especially with the foot and ankle, a lot of sprains, fractures, Lisfranc injuries. We have seen hand injuries. We have seen elbow injuries. You can name it. There's you will be amazed at how many injuries we treat with me and my partner, Dr. Wallstrom. So, but as I said, we treat quite a lot of those injuries, I will say that, in our practice, starting both foot and ankle, hand surgery, elbow, and related areas.
So then in sports medicine, how is it a little different, Dr. Wallstrom's? Like, what are your most injuries that you treat?
Yeah, so interesting background on me. So primary care sports medicine. So I'm not a surgeon, and in the sports med field, you can either go orthopedic surgery or you can go primary care. So my background is actually in family practice. So I'm actually triple board certified. I have allopathic family medicine residency, and then my boards, and then osteopathic. So I'm a DO, which opens up a whole nother thing. There's a difference between MDs and DOs. Dr. Chiem is an MD, and I'm a DO. And then I did a CAQ in sports medicine, which was an extra year long fellowship. So I do not do any surgeries, unlike Dr. Chima. I just have good colleagues to be able to send surgeries to if needed. So I see a lot of sprains and sprains and strains. Of course, that's the short answer. But a lot of what I see really varies on what season it is. So if it's football season, you're going to see a lot of ACLs. You're going to see a lot of shoulder separations or acromioclavicular sprains. Track season, I see a lot of growth plate injuries. So a lot of it just depends on the season. Right now, we're kind of finishing up wrestling season for the university and my high schools. So we see a lot of shoulder injuries, a lot of labral injuries. So really each season, my top three things that I treat changes because the sports change. So that's kind of the short and long answer of what I treat and how I treat, and a little more information, I guess, on my background on who I actually am as a primary care sports physician.
That's actually great. I was going to ask you about your education. It seems like you each have different sets of educations, with one being an MD and one being a DO, but what's the path, or how long is that process? And I don't know, maybe you want to start this time, Dr. Wallstrom, like how long were you in school and training
Ooh,
to get where you are today?
that's a great question. So I actually alluded to it a little bit earlier that I was not planning on doing this. I actually thought I was going to be a physical therapist for a long time, and was interested in chiropractic medicine and a few other fields. So I actually decided very late in the game, which I think is the opposite of Dr. Chima. I think he probably decided much earlier than I did. So technically in undergrad, I was only pre-med for 2 semesters. So I decided at the very end, I pole vaulted in college, and wanted to use up, I guess, all my 5 years of eligibility. I did have a red shirt year because I was mostly injured, as we talked about earlier as well. So I decided right at the end. So my path was a little bit longer. In fact, I got a couple extra degrees along the way. Actually graduated undergrad in 3 years, and then stuck around for a couple more and got another undergrad and finished up my pre-med during that time as well. Because the pre-physical therapy and pre-med had a few classes that were a little bit different. And then started grad school after that. So med school, just like the MD programs, DO programs, are 4 years. And then I did a 3-year residency, which was a dual residency, allopathic, osteopathic. So there are MDs and DOs in my program. Then did a 1-year fellowship in sports med. And then I moved here to Hayes after that. So a few extra turns, few extra degrees, but all of it was very much sports related. In fact, my undergrads are in nutrition, and the other one's in exercise science. So what's more relevant to sports medicine than those 2 degrees? So it all brought me here, and all was very beneficial to get me to this point. But you can definitely get done a little bit quicker than I did if you know from the beginning you want to do this.
Yeah, well, lots of different healthcare paths can come from that education that you received, for sure.
Yeah.
Dr. Chima, what about your career or education path to get where you are today?
I grew up in Pakistan, as I mentioned earlier, and my path is a little different being an international background. So, but I was interested in orthopedics to begin with, as I was a sports athlete. Even I was a sports secretary. I played during even my medical school. And so growing up, so then we start doing training orthopedics in Pakistan, and then I wanted to uh, increase further my training. So I moved to the US, and the way I prepared my training and how I did multiple fellowships. Considering I did a foot and ankle fellowship, I did a hand surgery and trauma as well as joint replacement. So I'm kind of trained in multiple specialties, and considering what Dr. Wallstrom was alluding to, I just started orthopedics too early, but that helped me and to practice in this region, especially where there's shortage of doctors and even the specialty practice. And since I came in, because I came in for my visa requirement, but then I realized, and people are very nice, hardworking, and so I just anchored in this place. And since then, I'm here for more than 14 years. And that's, as I said, my background with multiple fellowship, super specialty training helped me to treat a lot of patients, which we have to send to otherwise to the bigger cities like Denver, Kansas City, or Wichita. So, but going back to the U.S. System of education, obviously, for after undergrad 4 years, then you have to do 5 years of orthopedic residency, and then based on your interest, if you want to, which is more common these days, that general orthopedics are getting less and less, and more orthopedics are specialized, including different specialties like hand surgery, sports medicine. Even sports medicine has also different components like shoulder versus elbow and hand, and then joint replacement and spine service, as well as musculoskeletal oncology, pediatrics. So it does depend on your interest.
Thank you so much for all that background. And there is
Yes.
more and more that you can specialize in than I think there used to be. Jaron, do you have questions in the chat? I'm guessing there are lots of questions for both of our physicians.
Yes, there's a lot of interest with both of your comments so far. So a couple of them, including one from Shannon, who is there in Hays, Kansas with all of you, really wondering how many patients do you typically see on a day or maybe a week, depending on what's going on day to day? And then how do you keep a work-life balance through all of that busy schedule?
Should I start? It's a tough
Sure.
question. I
Dr.
will
Chima,
say
yeah.
that. Yeah, obviously, I tell everybody, I think one thing is you have to love your specialty and love your patients, number one. And as I said, we work in a Northwest Kansas, and I say that we are working in an island of care. So, and with orthopedics, there come some responsibilities. For example, orthopedics is more like a sports medicine, or even injuries you can treat maybe a little later. But there's a lot of other patients which need an urgent care. We are on call, and then we have to treat for them for acute injuries, for open fractures, for lacerations, for hip fractures. So that is a little bit of busy, but I think that was the one reason when I came into Hays that we have pretty good balance with work and personal life, as we were group up. Usually we are always generally like 4 surgeons as a group, and then also with our sports medicine addition, we have 2 providers, but initially we worked with Dr. Wallstrom for many years. That also helps. It takes a lot of like he can see a lot of sports activity, sports injuries, and other young fellows, which helps us to then, if we have to do the surgeries later, we can do that. So that's also, we have adequate size group. So I will suggest like once a month we are on call for the weekend. That's not bad, considering, as I said, the orthopedic and trauma services, we cover the both. And we also have a walk-in clinic, which is usually done by Dr. Wallstrom. So in that scenario, I think it's adequate work and personal life balance. But you should be also, if you like your work and if you feel like there's some missionary zeal to that, I don't think it's a bad in a sense. And the other thing which I will suggest, if you work where you are needed, that will also further like really give you a job satisfaction. Mm-hmm. And that's, I think, one of the cornerstone, and create passion in the work which we have in HaysMed for the same.
Dr. Wallstrom, anything you would add to that from your perspective?
Yeah, I mean, my schedule's a little bit different. You know, somebody gets hurt in the middle of the night, Dr. Chima has to come in and fix them. So his calls can be a little bit more difficult on the sleep schedule. I have around 15 athletic trainers that I oversee between the university, and then we have 5 high schools. So for them, I'm on call 24/7, 365 days a year. So I am on the phone a lot. They're constantly messaging me, calling me. We have secure messaging apps and whatnot that they're contacting me through. So it's really busy. If you don't like talking to athletic trainers, then it's probably not the profession for you. I have phenomenal athletic trainers and certainly enjoy working with them and could not do my job without them. They're imperative to everything that I do. So I do not have to spend all the time in the hospital that Dr. Chima does. I'm certainly very busy outside of the hospital and have to be available for them 24/7. We're able to bring another primary care sports med here in September, and she certainly has helped as well. Dr. Mater was on the video that we showed earlier, and she's been phenomenal help, and will continue to be so, and is happy to try to offload some of that for me as well. One thing that we also often talk about, and one of the misconceptions in medicine is, you think once you get to the next step, it's going to get easier and easier. I had an attending physician that I trained with when I was a med student that told me, no, actually each step gets busier and busier, harder and harder. And she was right. Your schedule gets busier and busier. I certainly have more on the plate here than I did in fellowship, and fellowship was busier than residency. All of them were tough. The one thing that I will say about that is each step along the way, you get to specialize more and more in the things that you love and are passionate about, and kind of wanted to do from the beginning, but you had to put the training in to get there. So while I am very busy, I'm that much more passionate about what I do. But don't go into the medical field if you want to work a 9-to-5 job. It's not gonna happen. So you got to be willing to put in the work, and it certainly is rewarding.
Well, I think it's clear you both are very passionate about the work that you do and the patients you're serving. So we're out of time, but there were many questions we were not able to get to. So thank you. But Cindy, we'll pass things back to you for now.
Yeah, thank you guys so much for joining us, Dr. Chima, Dr. Wallstrom, for sharing your insights into careers in orthopedics and sports medicine. I know that was one of the popular careers that folks wanted to learn about. So thank you guys both for sharing those careers with us today.
Thanks for having us, please.
Thank you.